doing ketogenic therapy and putting your symptoms into remission is step one of maybe a 10-step process. We're not done. And I'm not leaving you. I'm not abandoning you. You're still going to be a patient. We're still going to offer support because you do need support. You do need to learn these new skills. You do need to figure out who do you want to be in your next life, because this is kind of like a new life. It's a rebirth almost.
Hi, I'm Hannah Warren, the Mental Health Communications and Advocacy Manager at Metabolic Mind. At our 2024 Bazooki Group Metabolic Psychiatry Retreat, we brought together pioneering clinicians, researchers, and experts by experience, individuals who have transformed their lives through metabolic therapies. I had the privilege of sitting down with Dr. Christopher Palmer, a trailblazing Harvard psychiatrist and author of Brain Energy. My connection to Dr. Palmer began in 2022 after I put my bipolar 1 disorder into remission using metabolic interventions. As a volunteer, I joined a group of advocates to help him raise awareness of his brain energy theory. In this interview, we explore Metabolic Mind's newly launched THINK+SMART model, a groundbreaking metabolic framework for mental health. This model harnesses the collective wisdom of our experts by experience and highlights ketogenic therapy alongside other strategies for improving metabolic health, organized into actionable categories: sleep, movement, avoid, rebuild, and track. Now let's hear from Dr. Palmer.
Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey.
Dr. Christopher Palmer, thank you so much for taking the time to talk to me today. I really appreciate it.
Thank you, Hannah, for having the conversation.
Absolutely. So I wanted to ask you about this new THINK+SMART model that we're going to be launching soon. And to start off, I wanted to talk about the think component, which really involves ketogenic therapy. I'm wondering what you think the impact of ketogenic therapy is on patients and how that's going to impact psychiatric care.
So yeah, for everyone familiar with my work, ketogenic therapy can be life-changing, life-saving for many patients. I've seen many patients in my own private practice, but have literally heard from thousands of people around the world who had horrible, crippling, disabling, chronic mental disorders, bipolar disorder, schizophrenia, chronic unrelenting depression, OCD, and others, who tried years of medications, psychotherapies, hospitalizations, and nothing really helped them. And when they found ketogenic therapies, their symptoms went into remission. And many of those people have gone on to recover. And that means no longer identify as a patient with a mental illness, develop a full, thriving life. And so it can really be profoundly life-changing and life-saving.
Absolutely. And I've seen, it can be incredible for people like me who experienced a lot of side effects from medications and just want to get back to a better quality of life. And then, as you mentioned, patients who are completely treatment resistant, like Matt Bazooki, who nothing really worked for them until they found ketogenic therapy. And that was the cornerstone treatment that transformed everything, right? And allowed him and others to completely get their lives back and resume working and have relationships and live independently. It's really incredible. And of course, I'm very inspired by Brain Energy, your incredible book. And I think the THINK+SMART model really draws on what you were talking about, that there's a lot of different interventions and strategies that can improve metabolic health. So I was wondering if you had any feedback on the idea of this model, which is really meant to harness kind of the wisdom of our lived experience community, because there's so many different types of interventions that can improve metabolic health, right? When it comes to exercise or meditation, journaling, there's just so many different things that people can do. So what do you think about the THINK+SMART model overall?
So overall, I think it's really helpful and important because for most people, ketogenic therapy on its own is not going to be sufficient. And the reason I say that is because if you're doing ketogenic therapy and not getting adequate sleep on a regular basis, and you're using harmful substances like marijuana every single night, there is a good chance you are not going to experience a full and complete remission of symptoms. And there's a good chance you are not going to be able to recover. And it's not because ketogenic therapy isn't effective, it's because not sleeping and using harmful substances is assaulting your brain and impairing your ability to heal and recover. And so although a lot of people think, well, that's common sense, everybody already knows that, why do you need to say that? I can't tell you how many times I've talked to people who come to me, sometimes in tears, frustrated, trying to understand why isn't ketogenic therapy working for me? And within 5 minutes, I can have a quick conversation. Tell me about your sleep. Tell me about substances you're using. And I hear all of the wrong answers. And I think this is why ketogenic therapy isn't working for you, because you're not doing the program. The program is more than just ketogenic therapy.
Yeah, that's such an important point, and things like life stressors and not being able to handle stress well. And I also wonder, some of these interventions, I think, also play a really good role in reinforcing adherence and behavior change, right? I think about practices like journaling and how looking back on tracking helped me to stay motivated and stick with my therapies.
Absolutely. Everybody is going to need their own personal plan. It's not rocket science. I know some people get frustrated with me when I say stuff like that because they're like, so you're saying it's more complicated than just do the keto diet and I'll be cured. And I absolutely am saying that. It is more complicated than just do the keto diet and you'll be cured. But it's not that complicated. Most people should know harmful substances are a problem. Not sleeping is a problem. Having really high levels of stress or being in abusive relationships is a problem. Not moving your body is a problem. Not feeling like your life has any meaning or purpose. Not having relationships. Those are all problems. It's not rocket science. Most people should know it. But sometimes people do get to a point where they're at an impasse and they think, like, I haven't had friends in 30 years. What am I supposed to do? How am I supposed to make friends now? I have been a person with schizophrenia for 30 years. I lost all my friends. I lost my identity. I lost everything. What am I supposed to do now? And part of the work, part of the treatment is helping them through all of that, helping them recover. Sometimes I have patients who almost get afraid when ketogenic therapy does put their symptoms into remission because they immediately feel this tremendous pressure and this almost existential crisis of, oh my God, what am I supposed to do now? People are going to expect me to go out and get a job and be independent and have friends and do everything on my own. And I don't know how to do any of that. And I always just let patients know that this is part of our work. Doing ketogenic therapy and putting your symptoms into remission is step one of maybe a 10-step process. We're not done. And I'm not leaving you. I'm not abandoning you. You're still going to be a patient. We're still going to offer support. Because you do need support. You do need to learn these new skills. You do need to figure out who do you want to be in your next life. Because this is kind of like a new life. It's a rebirth almost. And you have a lot of exciting and sometimes difficult decisions to make about how do you want to spend the rest of your life. And, some people really want to give back. And that's an easy answer for some people. So they just want to give back and they think, I want to help others who were in the same position I was in. And that's my new purpose. Others don't want anything to do with that. They want to move on from a mental health diagnosis. They don't want to have anything to do with the mental health field ever again and just be normal and and that's great. I support anyone's personal decision to do whatever they want with their life.
Absolutely. I think all of the points you made are so spot on. And I'm kind of wondering, when people come to this model and discover metabolic therapies, one challenging thing is that people are at very different places in their journey. So I feel like being able to look at inspirational stories, there's a lot that people can draw on that relates to their own life. And I'm wondering, when you encourage people to start, everybody starts implementing behavior change in different ways. I know some people who want to jump right in and they want to do multiple strategies at once, like Lauren Kennedy, who's done amazing approaching everything all at once. But then you have people, I assume, who want to take it in more incremental steps. So when you have someone coming to you wanting to start metabolic therapies, how do you tailor that to their needs? Like, do you encourage most people to start with keto as a base, or like you mentioned, substance abuse and other issues? Is that something people need to address first, or?
At the end of the day, it's about empowering individuals to have agency. And part of that empowerment means letting them make the decisions. So when I see a patient who might have work to do in 5 different areas. They're not sleeping. They're not on a regular schedule. They're using harmful substances. Their diet is not adequate. They might benefit from ketogenic therapy, and they have no relationships. They're isolated in their apartment by themselves every day. That person has a lot of work to do. And I let them know that pretty quickly up front. Not to overwhelm them, but to let them know this is a journey. This is a journey, and we're going to start, and I'm going to be there with you, and we're going to get through it, and we're going to try to recruit other people to help you in this journey, whether that's family members or, some people do have friends still, and some people have other supports. Maybe they've got a therapist or someone else. So we're going to recruit a lot of people to help. But then at the end of the day, it's about creating a sense of agency. So it's empowering that person to make the decision. Where do you want to start? And for a lot of patients, by the time they come to me, they usually feel like their symptoms are the thing that have prevented them from having a full life. It's the symptoms that always get in the way. And they often will say, the reason I don't keep a schedule, the reason I don't have friends, the reason I am using substances is to cope with all the symptoms. I don't know what else to do. So for a lot of patients, it will start with ketogenic therapy to try to put the symptoms into remission. But again, if they're heavily using harmful substances, I'm going to just educate them and empower them, let them know, I don't think this is going to work as long as you keep smoking lots of marijuana every single night. I just don't think there's much of a chance of this working. So I'm going to lay it out. I'm going to be honest and direct with them, because there's no point in dancing around it and, trying to be nice. Some people worry that, Chris, you're going to overwhelm them. If you say they've got 5 things to work on and they're all really difficult things to work on, that might overwhelm them. It might. And I'm mindful of that, but they deserve the truth. And they deserve the truth that this is going to be potentially a 100-mile journey. And we have to start somewhere, and we're not going to get there. We're not going to arrive tomorrow.
That's such an important point. And I know both of us get this question a lot, like from loved ones. How do I inspire my son, my brother, to do metabolic therapies? And I know that, we can't make anyone do ketogenic therapy or other metabolic interventions. And one of the tactics you've spoken about before is motivational interviewing. And I understand a part of that is often giving people options and agency. So I like that this model is maybe a way of saying, look, these are some a variety of things you can do, but it's up to the individual to decide the most effective place to start.
Absolutely. The hallmark of motivational interviewing is empowerment and agency. And simply finding out what the individual wants to change or what is not going well in that person's life, because that's the reason they're going to put in the work. Whatever symptom they describe. And oftentimes it's very different than what the family wants to hear. The family thinks, you're not working, you're not taking care of yourself, you're using marijuana every night, you don't have any friends, come on, get with it. But to the person, they might say, I want a girlfriend. And we're going to go with that. Yeah. We're not going to beat them over the head with all of the other things that are wrong. We're going to say, okay, you want a girlfriend. You want love. You want connection. And how are you going to get that? What's getting in the way of you having that? And ultimately, it will likely come back to, well, I don't take care of myself. I have symptoms. Girlfriends might not want me smoking marijuana all the time. But it's the girlfriend, getting a girlfriend that is the carrot for that person and that's highly motivating. And so we're going to stick with that. And then we're going to figure out, okay, how much is that worth to you? What would you be willing to change? How hard would you be willing to fight to have a life in which you have a girlfriend or maybe even a wife? Like, how important is that to you? And you want to look for something that's really important to them, even when the family thinks that's not the most important thing. It doesn't matter what the family thinks. What matters is what the person thinks.
This makes me think of something that, we all know in metabolic psychiatry, it's really often difficult for people to find a provider who knows about metabolic therapies, like a therapist or a psychiatrist. And I feel like in this motivational interviewing, like having an unbiased clinician is probably pretty important. Like, do you think, how successful can family members be at motivational interviewing?
Motivational interviewing is really challenging for even the best of families, I'm just going to say. Because the usual default for most people, when they see somebody not doing well, is to give advice. It's not to do motivational interviewing. It's to stop doing that. If you're so unhappy, why don't you do this? Just, do this and everything will be fine. And that is done with love. It is done with love. And guess what? A lot of times that works. There's nothing wrong with that. There is nothing wrong with advice giving, because sometimes that's all people need. They just need education and information. And their parents give them advice. And they take that advice and it works out fine. Problem solved. By the time we get to the level where motivational interviewing might be needed, it probably means that the person's not listening to that advice, can't receive that advice, or that advice just isn't effective. The advice they're getting isn't effective. And that's when motivational interviewing comes in. So again, it's not that I'm trying to shame families for giving advice. Nothing wrong with it. A lot of times it works and it's perfect. But if you have been struggling with a loved one for months or years who is not doing well, everybody else in the world can see that this person is not doing well, but they just don't seem to be motivated or empowered to want to change anything. They're digging in their heels. That's when motivational interviewing can be really effective.
I hope that, someday we'll have more trained therapists and everything will understand metabolic therapies and can provide a tool, maybe like THINK+SMART, and take that motivational interviewing approach.
I do too. I mean, right now, metabolic therapies, most people don't understand them. They don't know about them. They hear about them in simplistic ways. Keto can treat schizophrenia, or unfortunately, even worse, to the skeptical clinician, keto can cure schizophrenia. When a skeptical clinician hears something like that, keto can cure schizophrenia, they immediately get, their red flags are going up right and left. And it's not that they're bad clinicians, they're actually really, really good clinicians. They are appropriately skeptical and they are worried that there is a charlatan around, Somebody's trying to take advantage of this poor, vulnerable person suffering from schizophrenia. And the clinicians want to protect people with schizophrenia from misinformation, disinformation, whatever we want to call it. They want to protect people from charlatans and scammers. And they hear a soundbite like that and they immediately think, that's impossible. This must be a scam. Somebody's trying to take advantage of my poor, vulnerable patients. So I think we, as the leaders in this field, need to be mindful of that and need to understand that the clinicians are actually really good people. They really want to help and protect their patients. And if we can understand that, then we can have more balanced, nuanced conversations. And clinicians don't want to hear about miracle cures. Clinicians want to hear about science and evidence and how many people is this working for and how powerful is the treatment. But if you can have a longer discussion, even just a few minutes, but if you can have a more nuanced discussion about some of the science, I'm hoping that will help to just intrigue clinicians and help encourage them to learn more.
Yeah, and I'm hopeful that this model could help us have those more nuanced conversations and to be very clear that ketogenic therapy isn't a silver bullet. And when you talk about all these different interventions, many of them already have a research base, right? When it comes to talking about sleep and exercise and all the different modalities that we're encouraging. So hopefully this model will help with the skepticism.
I think it will, because it does say there's not a silver bullet here. We're going to integrate ketogenic therapy with some common sense, evidence-based lifestyle interventions that every mental health clinician knows play a significant role.
I think this is the perfect time to talk about, we were going to dive in depth a little bit on one of the interventions, which is our movement category and exercise. So I'd love to hear your thoughts on the role that exercise can play for patients on their metabolic therapy journey.
So exercise can be really important. It's actually not one of my top pillars. I think that, I would put diet, sleep, and removing harmful substances or reducing harmful substances as the top 3 pillars. And if those things are not yet in place, I would prioritize those before prioritizing exercise. If a person is already exercising, keep doing it, of course. So the rule of thumb, exercise is good for you, yes. Mm-hmm. Can you overdo it? Yes, you can. And there are certainly in the mental health field, there are people who have anorexia nervosa, for example, who overdo it. They are stressing their body, they're already malnourished, and they are using valuable kind of calories even to go run marathons as opposed to, build muscle and restore their health. So, but those are relatively rare people, but we need to just keep that in mind so we can't say everybody should go out and exercise more, because that isn't really true. There are already people who are adequately exercising, and there are others who are maybe even over exercising. So it's not a one size fits all. But for the most part, people will benefit from more movement. And I'm a big fan of, again, meeting the patient where they're at and then empowering them. So trying to figure out, what do you like to do? What would be enjoyable? What would be less painful? If they say, oh, I hate exercise, I feel so tired and drained, and I'm going to have conversations with them about how, yep, I get it. You do feel tired and drained. So validate that. Let them know, yes, you do, because you're metabolically unhealthy. That's why you feel tired and drained. That's not your fault. It might be the fault of just years of a metabolic disorder. It might be the fault of some of the medications you're taking. It might be the fault of other things. So we're going to validate. You're not lazy. You're metabolically impaired. That's why you lack energy. And then we're going to meet them where they're at. So if it's somebody who could use a little more social life, if we can pair exercise with a social activity, that would be amazing. That's like a twofer, if you will. And that could start off with just take a walk around the block with a friend, or go hiking in the woods with a friend. Maybe work your way up to a little bit of a jog every now and then. Every few minutes, just, do a little bit of a jog and then walk again. It could be tennis. It could be any a team sport or anything. So there are so many options and opportunities. Even just going to the gym. For some gym communities, they can be extraordinarily social and empowering, and you can get to know people there. A yoga class, a CrossFit class. I mean, there are lots of options.
Yeah, I was excited to talk to you about exercise in particular because of your view. Your view is so validating for people just starting off that, yes, you literally don't have energy, right? That's the way the brain and energy kind of theory informs that. Because I think a lot of patients, sometimes when you come to them recommending things that may be outside of their comfort zone or what they feel their abilities are now, to be able to really empathize with where they're starting.
Yeah, I think that's so important. And I think it's really important. So going back to something I said earlier, like I lay it all out for patients. Like we've got 5 areas that we're going to work on. As I'm having that conversation with patients, I am always mindful that what I'm saying to the person probably sounds ridiculous and probably sounds impossible. And in their mind, they're really thinking, there's no way I can be this person that you're describing. There's no way I will ever have energy to go exercise voluntarily. There's no way I can have friends. There's no way my symptoms are going to go away. Those are all impossible things. I've been battling this illness for years or decades. You don't know me. We have to be mindful that that's where they are right now. And they probably have heard a lot of false hope narratives. Try this pill and it will fix you. Let's try another. Let's try a 15th pill. Do this therapy. If you just do this therapy and try harder in the therapy, everything will work out fine. So they themselves have heard advice given from professionals year after year after year, and it has not worked out for them. So by the time they get to me and I'm here, Mr. Happy, Peppy, saying, oh, we're going to fix you up. I get it. I'm right there with them. I know how hopeless you are. I know how skeptical you are. There's nothing wrong with that. You have every right to be skeptical. But I'm here to tell you, you can do it. I'm here. I believe this might help you. I don't promise them that it's guaranteed, because nobody can guarantee anything. But I let them know that I've worked with countless people just like them who have actually gotten to the other side, who have actually recovered. And if it works for them, it could work for you too. And are you game to try? And then we embark on that journey.
And I love that you hit on something else when you have a more complex model. It's interesting how sometimes you can tick multiple boxes at once, right? Because if someone goes to a yoga class, it's like a mind-body intervention, which is part of our rebuild and rebuilding purpose through connection and community, and at the same time movement. So it makes for a lot of opportunities.
Absolutely. And stress reduction. So I mean, something like yoga is doing a lot of different things all at once. And yeah.
Yeah. So when you talk about trying to inspire hope in patients who likely feel defeated after trying many different things and not seeing outcomes, I think one of the other incredible things about this model is, of course, talking to a lot of different people with lived experience about, coming from a very similar dark place and eventually finding metabolic therapies as something that actually is effective and completely transformative. And, yesterday we had an incredible lived experience panel where Lauren Kennedy spoke, Harmony Bright spoke, who is also in remission from schizophrenia, Eric Rogers, who is in remission from chronic depression that was very debilitating for him. And as this movement grows, I mean, I think we're just seeing exponentially so many people coming forward with these incredible stories of transformation. You know, like Harmony said yesterday, she had 16 years of like intense symptoms and agoraphobia, and now she's here on a stage speaking in front of all these people. It was so moving. And, you know, telling you, I didn't know what I was doing. I didn't know how to make this work for me. And then I discovered brain energy, and now I'm here on stage. Like, this must be so incredibly, I can't even imagine how you must feel hearing these stories of people saying, you know, your book saved my life.
Yeah. I actually I'm not going to start crying now, but I start crying a lot at home. And it actually still to this day feels surreal. Because I'm kind of like, how on earth has this happened? How did I do something that helped people that I haven't even met? And it helped them enough that they say things like, you saved my life. I've received, I can't count the number of emails where that is literally what people wrote. You saved my life, and you don't even know me. And I think for me personally, it gets into, I have my own history with mental illness. I grew up hating myself, feeling completely defective. I tried to take my own life several times, a couple of them very seriously. And I'm not anywhere in that dark place. I haven't been in that dark place in years, but I remember that dark place. I remember what that's like. And really, that is still at the core of who I feel like I am. That's who I am. And so to think that I've done anything special, let alone that special, makes it even more just kind of surreal in my mind. Like this must be a dream. Like this can't be possibly happening. But I think my own personal experience with depression and suicidality and just chronic low self-esteem and self-loathing, I think that's at least a little part. It's not the entire story, because I have a mother and all sorts of other parts of my story, but that's a big part of the reason that I am so passionate about this, because I feel like I've been in that hell. And if I can help other people escape it, like that's such a great purpose to have in life. Help people escape their hell.
And, you know, you talked about this earlier, that you kind of get two different perspectives when people all of a sudden achieve remission. You know, you get people who want to make this their entire life mission after seeing the impact, and those who just want to forget that it ever happened because they're finally free from symptoms and they would just want to experience life. But I think that's what's incredible too when you see people like Harmony and Lauren and Eric, because through having their life saved through this work, now all they want to do is help this movement and spread the awareness and to reach other people. And so it's having this tremendous ripple effect that I really do think is going to transform countless lives. And, you know, some of the work that you've been doing in DC to raise awareness, you were at the first Metabolic Revolution rally and, you know, talking to politicians and really trying to create systemic change, but from this very personal, you know, perspective and motivation. So how do you see this movement evolving and ultimately really advancing this kind of transformation that we desperately need to see in psychiatry?
So my sense is that, you know, the mental health field and just even the healthcare field in the United States really actually does need redesign. And that word actually comes from the Institute of Medicine. They did an annual report 18 years ago now, in which they said our healthcare system is so flawed that it requires fundamental redesign. And I don't say that in any way to denigrate healthcare professionals. Healthcare professionals are doing their best. The healthcare professionals that I know by and large are really good, decent, hardworking, like extra hardworking people who desperately want to help the patients in front of them. So I don't say fundamental redesign to put them down or make them feel bad about the job, but it's that they aren't given the tools and resources and time that they need to help people heal and recover. And so when I think about the advocacy work, metabolic therapies are not quick, easy 10-minute visits once every 6 months. Pills can be. You can see a psychiatrist in 10 minutes and they can write you a prescription and see you 6 months later. And that is a model of healthcare. I think that model needs to be replaced, that we need a better model. And that's going to require a lot. It's going to require a reconceptualization of how can we integrate mental health care with primary care. It's going to require a reconceptualization of using lifestyle interventions instead of pills. Not that pills aren't still going to play a role, not that we're going to eradicate them, but we're maybe going to shift the prioritization and we're going to allow for resources to be spent. I mean, a lot of people can't get a dietitian through their insurance company. If they want a dietitian, they have to pay for it out of pocket. That needs to change. There's so many things that need to change. And the reality is there are very powerful multi-billion-dollar forces that don't want change because they're benefiting from the current system. And if I owned a multi-billion-dollar company, I wouldn't want anything to change either. I'm sure I would be perfectly happy with the way things are, and I'm really rich, and it's great. But the people deserve better. And those interests aside, the people deserve a better healthcare system. We, the United States, deserve a better healthcare system. And for those who don't know, we have a mental health epidemic. Mental disorders are increasing in prevalence across a wide range of diagnostic categories, all the way from depression, anxiety, to bipolar, to autism, to ADHD, and others. At the same time that physical health is also worsening, obesity, diabetes, and other conditions. And so I think the most powerful strategy is for us to align with other groups who share that vision. There are many groups, mind-body medicine practitioners, lifestyle medicine practitioners, mental health advocates. There are so many other groups that are all fighting for change as well. And there is a lot of synergy and common interests in terms of the changes that we want. There are a lot of differences of opinion too. And that's okay. We can still work together on the things we agree on. And so I am a really big advocate of finding the common ground with other large constituencies that are already doing advocacy work, that already have an organization, and we need to work together. We all need to join forces to improve the healthcare system with the ultimate goal of improving the health and wellness and both mental health and metabolic health of the population.
I couldn't agree with you more that we really need to come together on the things we can agree on and push for change to create a larger movement, because we're up against, such a tremendously difficult system to change, right? So we definitely need to come together. I think that's the perfect place to end. And I just want to thank you so much for your time and all your invaluable insights. I think you shared so many amazing perspectives, and it was great to get a chance to talk with you. And I guess one more thing I want to say is that I hope you'll start to have faith that you have done something tremendously special and you are invaluable.
Thank you,
to this world and to me. So
thank you.
You changed my life too. I'm one of those people.
It's still surreal. I'm ready to wake up from my dream tomorrow. It'll all have just been a nice dream, but in the meantime, I'll enjoy it.